On the 1st of December, the global community unites to observe World AIDS Day, a pivotal day dedicated to raising awareness about HIV and AIDS, its prevention, treatment, and honoring the memory of those lost to AIDS-related illnesses. The global theme this year, Let Communities Lead, has been domesticated in Nigeria as communities' leadership to end AIDS by 2030. Annually, the National Agency for the Control of AIDS, NACA, orchestrates a series of programmatic activities preceding World AIDS Day. It begins with a press conference held at its headquarters in Abuja, setting the stage for a week of impactful initiatives.
Every year we see decline in the number of people dying from HIV. Every year we see decline. Every year we see decline in the number of people getting new HIV infection. We believe the hard work of our stakeholders, partners, at community, at facility level, all over the country is working. And because of that, we are here to tell the global community that Nigeria is recording success. Nigeria is progressing towards ending AIDS as public health problem by the year 2030. And we have made commendable success over the last couple of years. And I want us to sustain this tempo to ensure that Nigeria is not only leading in Africa, Nigeria is leading globally in terms of progress towards ending AIDS. We estimate we have about 1.8 million out there that have the virus. Out of them, we are able to get 1.6 plus. It's a very good progress for our country, and it's a very good progress for the program we represent. And we look forward to sustain this tempo and make sure that in alignment with the renewed hope of President Bola Ahmed Tinubu, no one is left behind. No one is left behind. And we make sure that we end inequalities. We end inequalities in terms of access. We end inequalities in terms of discrimination. We end inequalities in terms of the services that are being provided. And at this juncture, I would want to thank our global partners, especially PIFA, United States PIFA program, the Global Fund, the United Nations Joint Program on AIDS, for the unflinching support to our dear country. The support has been strong and it has been sustained for over the last 2 decades. I want, on behalf of the President and on behalf of the country, register our appreciation. As I conclude, I want us together to know that this collective leadership that want to put communities in front, that want to see communities leading and drive the response forward, is one that we want to do it in an integrated fashion. We want to make sure we are all in it, and its leaders to ending AIDS and to making sure that all structures that need to be put in place to sustain this response beyond 2030 without Nigeria slipping back into a HIV disease or endemic country are taken and are ensured that we get them right. Thank you.
Goodwill messages were delivered by representatives from partner organizations, civil society groups, and relevant stakeholders.
We've made remarkable progress, not only in Nigeria, but worldwide. With about 30 million people who are on treatment. I think this is remarkable. AIDS is no more the deadly disease that it used to be. And those who are diagnosed with HIV, following the WHO protocol on test and start, who are swallowing the medication, so they can live a normal life. Life expectancy of somebody who is HIV positive, tested and then put on treatment, it's equal to that of somebody who's seronegative. But If we have, as DG have said, about 1.6 million people on treatment out of the 1.8, it shows that not everybody has been tested as on treatment. So we still have a gap of people with HIV and AIDS out there that we need to identify and put on treatment. New infections have declined, maybe not enough, and we still have children living with HIV and AIDS that we cannot find and put on treatment. The theme of this year is led community leads. So that community is important in the advocacy, in the service delivery, in the monitoring of resources, and also the accountability. So they really have a key role. I will end by pledging again our continued support at the state level, at the federal level, in such a way that we can continue as UN, as a joint program to provide the necessary support to end AIDS in Nigeria by 2030. Ending AIDS in Nigeria is possible, but we should put the community at the center. We should empower that leadership to make it happen. Thank you very much.
There's a popular proverb I wanted to start off with, which often says that if you want to go fast, go alone. If you want to go far, go together. And I think the magnitude of all of us at the table together is demonstrating that to achieve the end of HIV as a public health threat by 2030, we can't do it without each other, and we most certainly cannot do it or accomplish it without communities. And the speakers before me have already shared what happened in the early 80s and 90s with over 40 million people who died. And during that time, we talked about palliative care. And who provided that palliative care? It was the communities. They were the ones who were providing support, comfort, and solace at a time when there was simply just no treatment and no other option. But we no longer talk about palliative care, and now we need to talk about integration and comprehensive services for the over 1.63 million people living with HIV here in Nigeria. And we're going to continue to rely on the communities to guide us, to advocate, and help ensure that we don't delay, that we don't take our foot off the pedal, and that we don't forget those who still remain unseen and are missing. So this year's theme is a mantra and a call to action. We can't achieve our goals unilaterally, and the communities are the glue that really are keeping us together and interconnected, and they will continue to bring those voices to us to help us ensure that we all hold ourselves accountable. So as we commemorate this year's World AIDS Day and celebrate the continued contributions of civil society and communities, please know and be reaffirmed and reassured that the US government, we're not ending our contributions or support when we hit our 2030 landmark. We are here to remain partners, and we are here to ensure that Nigerians living with HIV, in collaboration with the leadership of government and civil society and communities, that we sustain those gains well into the future. So thank you.
The theme of this year's celebration in Nigeria, Communities Leadership to End AIDS by 2030, recognizes the need for the communities to take the lead in the HIV response and interventions to end the AIDS epidemic as a public health threat by 2030. To achieve this, distinguished ladies and gentlemen, we need to put the communities and networks at the center of the response and ensure equal access for all, with the aim to close all existing gaps to treatment and prevention services in order to end AIDS. For the communities to lead, government at all levels and partners inclusive must support the communities more than ever before in all areas of the response. While we look forward to the opportunity to enable us to lead, we also look forward to continued collaboration, working and partnering with everyone working for the interests of HIV to end HIV by 2030. Permit me to use this opportunity to call on government at all levels in Nigeria, especially at the state level, to increase their commitments in the fight against HIV towards ending AIDS by 2030. As NEPLAN, our aim is to ensure that we contribute significantly to scaling up effective and efficient HIV programs in Nigeria to end AIDS as a public health challenge by 2030. Distinguished ladies and gentlemen, thank you for your attention.
We are very proud of the attainments that this country has made, and this effort is not possible without Global Fund, PEPFAR, different donors who have brought in their resources. But the theme of this year is really apt because we are saying that while we've reached the crest of the epidemic in terms of case finding and people on treatment, there are communities that are disadvantaged. The communities of people who are living with HIV, the community of key population, women, especially pregnant women whom we are struggling to find, children. Only 36% of the children who should be on treatment have been found and have been placed on treatment. And the vulnerable groups of young people, including adolescent girls and young women. This is where we should move to the last mile. And that is why the theme of this year World AIDS Day is not only to reach those communities, is to empower them and make them leaders. We know that in Africa is the one who is wearing the shoe, who knows where it pinches. So we need to aggregate the efforts of these beneficiaries or stakeholders and get the epidemic into control in Nigeria by 2030. Ladies and gentlemen, I'm very pleased to be here and to identify with NACA as always during the World AIDS Day. Thank you very much.
Human Biology Nigeria has been in the business of supporting people living with HIV for almost 20 years now. And in all the years that we've worked in this community, we've always supported communities and worked with them. And so as in line with this year's theme of allowing communities to lead, we're going to continue to support communities as they lead to end AIDS globally. And we're going to continue to support the drive to end inequalities in all of its ramifications, and also drive the integration of programs for better results, because we believe that that's the way to go for to end HIV. We also like to acknowledge the progress we have made as a country, and I think that as communities lead, we will continue to support in achieving the goal of ending epidemic control. Thank you very much.
Representatives of the Federal Ministry of Health and the National Assembly also lent their voices to underscore the government of Nigeria's unwavering commitment to ending AIDS by 2030.
As a country, we've made significant progress in terms of what we've been able to achieve to control the epidemic in the country. As you know, Nigeria is moving towards a state of epidemic control, whereby we are going to have the HIV infection in Nigeria, just like every other chronic disease like hypertension, like diabetes, just make it simple for everybody, which can be managed well with good treatment that is available. Even though there is no permanent cure, but there's enough treatment to maintain and sustain quality of life, good quality of life. So this essentially again marks another one to say this time around we want the community themselves to live in terms of leadership, in terms of participation in their decision making, and in what we do as a country. So on behalf of the Federal Ministry of Health, we are always committed to drive the health sector, the provision of care, treatment, and of course strengthening the community in such a way that we can keep making definite progress we are making so far. So once again, we congratulate everyone for another event like this, and we're happy to say other partners are committed to keep supporting the government and our people in achieving the positive drive. So thank you once again, and I bring greetings from the ministry as we proceed with the march of the World AIDS Day for 2023. Thank you.
I must say that the National Assembly is proud of the tremendous achievements recorded by NACA. Under the leadership of Dr. Ali Gambo and his management team. And we in the House Committee on ATM will continue to support NACA with legislative measures and interventions that will greatly impact on the agency's capacity to effectively deliver on her mandate. The theme for this year's celebration is community's leadership to end AIDS by 2030. To achieve the above, and indeed for NACA to succeed, the issue of funding is critical, and that is one of the major reasons I'm here, to make sure that the National Assembly appropriates enough funds to help us eradicate. I am aware of the target to eliminate mother-to-child transmission of HIV through AIDS by year 2030, and the fact that national coverage of prevention of mother-to-child transmission is less than 50%, leading to about 22,000 cases of mother-to-child transmission of HIV every year in Nigeria. And for NACA to provide treatment to a greater number of these and keep communities from about 200,000 to an estimated target of 200,000 by 2024. More resources need to be mobilized, and by special grace of God, the government of His Excellency Bola Ahmed Tinubu will make sure that we give our best. I am convinced that if all leaders at different levels show the willingness and commitment to ensure community systems and their structures are strengthened, resourced and empowered, our mutual target of ending HIV/AIDS by year 2030 will be attained. On behalf of the Honorable Speaker, Right Honorable Tajuddin Abbas, I wish you all a happy World AIDS Day. Thank you, and may God continue to bless you.
The day's proceedings culminated with HIV testing and counseling, offered by NACA staff to the public just outside the premises.